The interesting demands of a Monday GP locum. So I've been doing a locum at the moment. There was some floods you might have heard about last year in the Lismore area. And because of those floods, 3 GP practices were closed. And so the entire population of Lismore had to be dispersed to the surrounding medical centres. And those medical centres have obviously had an increased amount of people, but also people in significant amounts of trauma and difficulty in recovering from these events. Now, in light of that, there was an opportunity for a couple of doctors to get a break. Just go and have some time off and R&R, rest, recuperation. And so they called me up, the PHN, Primary Health Network, was like, hey, do you want to do a locum? I'm like, yeah, sure. What do we got? And it's been interesting to see the demands, because on a Monday, suddenly there was, I reckon, 4 patients coming off hospital experiences with discharge summaries, but I've not seen those patients before, so I don't have any background information. I've got these discharge summaries, anywhere between 3 and 6 pages, considerable amounts of information in there, and just having to put it all together. Phone calls to be made. No, we don't actually. I had to call the pathology for New South Wales Health, but because the patient saw them in Newcastle, not Lismore, they're like, no, we can't do that. You need to call Newcastle. So I call Newcastle, get the results. It's very demanding just to process the amount of information that's coming in, the patient, the discharge summary, where are the results that I need? And then I'm over on best practice, which is really interesting to be using that software versus Genie. Definitely does some things better, but it also does some things that are not so great. In Genie, it's very easy to see the past history. In best practice, you've got to open clicks to make sure it's going on, that it opens up. But the overall experience was that I think each of these patients was booked 15 minutes, took close to half an hour, just in terms of making sure all the T's were crossed and the I's were dotted. Meant I had, I think, about a 10-minute lunch and then back into it. But the focus that's required was very significant, very challenging. I'm kind of exhausted right now. I'm like, whoa, man, this is demanding. Could it have been done better? Well, absolutely. 2 standout things. Obviously, I didn't have my health record available, my PKI or whatever it is. It hasn't synced into best practice, and so I can't see my health record and can't get access to this stuff quickly. So having to make the phone calls, very frustrating. But more than that, I've touched on this before, is the single source of truth of medications. That would have been really interesting. That would have been really helpful. That if best practice and Genie and New South Wales Health and Queensland Health and all of the health systems had a single location for the medications, then this would be really helpful. Like, as I log into that patient's file, it syncs up what was changed in the last hospital admission. And suddenly, or one of the patients is like, I got a phone call from the intern saying, stop that medication. I'm like, oh man, there's zero documentation on this. I check out MIMS. They were like, your kidney's not working. I look up the medication. I'm like, yeah, but your kidney's at 46, EGFR at 46. It says only reduce the dose to at less than 30 to the dose that they've given you already. I'm like, oh, this is a mess. Where's the information? Where's the data? But that is a step beyond. To be able to actually see all of the interactions that have gone on, we're probably a while away from that. But what would have been really useful was to at least know what the current medications were and see that the medication that was meant to have been stopped by the intern had been stopped, or I don't know. I left him on. I was like, look, as far as I can tell, you're meant to be on this. This is a good medication for you. But it definitely brings up a sense of doubt. It's like, I don't know, is there some information that I'm unaware of? Was there another factor in this decision? Did they have a discussion with the consultant, and then the consultant said, call this patient, but the patient didn't document the conversation correctly? All they get very challenging stuff. And so this working in an incomplete knowledge field is very challenging. It's exhausting. We lost internet there for a second. Can we do it better? My health record has the ability to do this as the single source of truth for medications. And if it's not going to be done by the government, then perhaps someone else can step in with blockchain or something cool so it's protected and it doesn't keep getting hacked. But that single source of truth, I make a change to the medication and everyone's aware of it. The pharmacist's aware of it, the patient's aware of it, the hospital's aware of it, the specialist's aware of it, another GP's aware of it, they go to a different practice, they're aware of it. Single source of truth, so that we're actually aware of what the patient's on, what the dose is, what changes have been made. It can be done with SafeScript for the S8s and the benzos, but we need it real time for the entire charts. Reduces errors, increases understanding, and perhaps if that worked as a small step, then we could move to a greater understanding of like, okay, where are we going to store all of the decisions that are going on? In the meantime, there's one key thing that I took out of this, and that is that if I show up a certain way, if I'm not informed, if I'm not looking after myself, if I haven't meditated, if I haven't trained, if I'm stressed out and I'm worried about my life, then my risks go up. In these circumstances of which I cannot fix many of these things, we're not going to get single source of truth anytime soon, but it would be really good. What can I control? And this is a question for you. What can you control? And I would suggest to you that it's your mindset, your skill sets, your meditation, your exercise, your ability to study, your ability to be aware of the risks that we face as doctors in this imperfect situation that we find ourselves. All right, that's all I got for you. If you want some more info on that, head over to graduatemedicine.com and join the Clinical Certainty page there. Otherwise, if you want to reach out to me personally, hit me up on the Facebook page with a message. I hope you're having a great night. Look forward to catching up with you very soon.